Hello and welcome. This is the Senior Estate Concierge, and today we're talking with Dawn Bloomer from Interim Health Care. Hi, Dawn. How are you today?
Hi, Marian. Good morning. Very well. It was the last day of October.
It is, and that explains your shirt.
Yes,
Yes,
yes.
you have little pumpkins. You're getting ready for maybe a party.
We are having our employees invited to come in for lunch and pizza and candy and cupcakes and a costume contest. So hopefully we'll have a little turnout and put some fun things on our social media pages and thank our staff and people can come out and enjoy this nice cool weather here in Houston.
Just a few days ago it was hot.
This is nice. We're enjoying it. Long sleeves.
I
Yeah.
know. I even have a sweater on. It's
Yes.
awesome.
Yeah.
Yes.
It's something to celebrate. So, yes.
The changing of the seasons can be a fantastic opportunity for people to feel like they're living in a place that has more than one season.
Mhm. Yes. It's been a
Summer in
long
Houston,
summer.
yeah, summer in Houston seems to stretch on and on and on. I'm not really sure, how that happens, but it just does. It seems to have we have summer and winter, and our winter is
Right.
like this little. So
Yeah.
it's
We'll
okay.
enjoy the next few months.
That's right. So we're going to talk a little bit about the Senior Estate Concierge, the group, your experience in it, and I do want to thank the founder. This man, his name is Bill Graff, had this idea when he was selling real estate to seniors that they needed more than just a real estate agent. They needed somebody to call to maybe help mom or dad or both, you know, pare down the house, move into maybe a senior living facility or a nursing home. And he needed some resources. So he got together with some of his friends and they started this group, and it just grew from there. And you're part of that group, Dawn. And so I would love to hear a little bit about how you fit in here, what you think about the Senior Estate Concierge, and maybe even some of the things that you can see in the future, because you have brought a lot of things to light about our group. And so I'd love to hear more from you about the Senior Estate Concierge.
Well, I was excited to learn about the Senior Estate Concierge. A year and a half, 2 years ago now, maybe time has flown. Um, they had a compelling mission because there are a lot of networking um, groups for healthcare, and there's a lot of regional networking groups. There's a lot of just business to business networking groups, but this one was specifically focused on the care of seniors, and they had a dynamic membership. And so I was lured, honestly, at first by the Facebook posts because your feeds would get picked up in my feed. So I was like, I need to check this out. So I did go to the first general meeting to get a feel for it. And it was everything it was represented. You had great speakers, quality members and referral sources that you could trust, and a platform that was action oriented. So, there's a plan to follow to try to leverage the resources and help in that group so that you can take better care of your clients ultimately. And that's almost how every meeting is started, is with the mission of the group to, have trusted resources, basically, because there are a lot. And it was important to Bill that the people are vetted and have, background checked and that and have a proven business and personalities behind it that can be trusted, so that he makes his business look good and everybody else makes each other's business look good, and there's a confidence within the group to help each other.
Well, I'm glad you feel that way because
Mhm.
I am now the marketing manager for the group,
Mhm.
and I can't tell you how much that means to me to have a job that fills your soul, to feed you what you need to get up every morning excited about what you're going to do and who you're going to help. The seniors need help. Not only do they need physical help, but they also need emotional help, and they need trusted people who can come in and do whatever. Okay, from mowing the lawn to
Right.
repairing something in the home, putting in grab bars, all the different things
Mhm.
that seniors need as they get older.
Right.
It's just a wonderful opportunity for me. Now, I'm a senior myself, so it just makes me feel good that we have people like you out there and the rest of the group who you said they're vetted and they know what they're doing, and they use the group to refer people that they can trust to come into the home of the people that they're working with. Feels good.
Right. Right.
Yeah. So, okay, now I would really, really, really like to talk a little bit about you and your business. And can we start from the beginning? Like, how did you get here?
Wow. There's a long way from the beginning, but my background is nursing. So I started my career in nursing. Had a bachelor's degree from the University of Kansas, Rock Chalk Jayhawk, and actually started out in pediatrics. So in Kansas City, but did home health almost immediately. And my first home health um, experience was actually moonlighting with a company because met a patient in the hospital that was going to need care at home that we connected with. And this was at the time of the AIDS epidemic was at its height. And so my foray into home health started with meeting a patient in the hospital that needed care. And we cared for that client in the home until a pediatric client till he passed away. I had a lot of impactful moments early in my career as it relates to home health. Somewhat interesting is a few years into it, I had an opportunity to travel internationally to be in the field of nursing. So most of my mid to
Fantastic.
late 20s to 30s were in the Middle East. So I did actually facility nursing in Saudi Arabia for 3 years for the Saudi government, and then came home for a little bit and went back to Abu Dhabi and did 2 years in Abu Dhabi, again at a facility, at a hospital, big hospital system run by the Canadians. And in that role, I moved from bedside care to computers. And I got very involved in a platform called Meditech, which helps computers in hospital systems. And I was called a nurse liaison. And so there's a whole industry called health information sciences. And I was fascinated by that. That's when I got my master's degree in. So after returning from the Middle East, I had got my master's degree in health information sciences, and had my son. And that was 17 years ago, 17 and a half years ago. So about the time my son was 2, I thought I would be going into health information sciences and nurse informatics, but I ended up in leadership and administration in a Kindred hospital. And from that, ended up being recruited to be an administrator back to home health, back to my roots, back in Houston, and have been in Houston ever since. Most of that time was with one company. Grew with that company, was very involved with professional associations such as the Texas Association for Home Care and Hospice, a great organization that also helps represent the needs of licensed entities that provide home health care in Texas, very specific issues. About 3 years ago, decided to go out on my own. So that was a big leap to go from running a large organization, very focused on compliance and doing the right thing. I had my certification in healthcare compliance, to being a business owner and being part
Totally
of
different, isn't it?
it's totally
Totally.
different.
Yes.
So we are into our third year of a franchise and a franchisor that is more than 50 years in business. They were probably the first home health franchise, home health care company way back when, and it offer incredible support. So, and we did our research, enjoyed, appreciated the market that we were going to be working in, and that's how it started. So that's how I got. So it's been 3 years of owning my own business and growing it, and it's the hardest job I've ever had, and every job I have had has been hard.
Yes. Yes, it's.
But we're now taking care of seniors in this part of town, and they all have a lot of needs, especially. We touched on this a little bit but especially starting a new business, even with all of the experience I had, that's a challenge. And then starting a new business in a pandemic, which has, just amplified every probably stress point of providing care and running an operation. So it has been a challenging time. But
I really want to get
it because you can immediately return to the many needs that come up from different people, whether it's home health, legal, home modifications, where to get help with hospice, what's the right place for them for that chapter in their lives. You can't do it alone.
Exactly. And I really do want to get into that. Let's talk a little bit about your franchise. I'm gonna put up a little thing here that shows the front of your website. It looks very nice, very happy. You're providing expertise with a caring hand for over 50 years. That's the company that you bought the franchise for. And what part of town are you in?
Well, our location is in the southeast, so we're very close to the NASA Space Center. It's basically across the street. So there's a lot of pride in this part of town. We have the benefit of the breezes off the Gulf of Mexico, which makes it a little bit more temperate than downtown Houston. But we service all the way to Lake Jackson, Galveston, Pasadena, Deer Park, Harris County. We even have Southwest coverage. Our office is in the NASA area, but we will service clients throughout the greater Houston market, mostly south, southwest, and central, all the way down to the coast.
Wow. Now that is a big undertaking. Now, your franchise, does that mean that no one else can come into the Houston area? You cover the whole area?
That's a great question. So Interim Health Care does, like many franchises, sells territories. And we have a partnership with the other interim office. There's 2 in the Houston market, but we do different lines of service. So they are going to focus on Medicare, home health clients, and we are going to focus more on in-home personal care, non-skilled type services for seniors that don't need skilled interventions, but they want to have a place to stay home safe, or they need an extra level of support during a hospice episode, or they need an extra level of support during transition from home to assisted living. They just our support takes a variety of forms, but not Medicare. So we have interim in our area doing Medicare, but it's not our particular licensed office. But by the same token, we can provide care to seniors in their homes throughout their territory as well. So it's a partnership.
Mm-hmm. Yeah, I love partnerships. That to me is where my heart is. I love working with instead of against. The old days when people, felt very territorial and they didn't see the benefit of working with someone or with a company. They saw it as, you're going to take over my business, And it's been a process, but I've noticed that more and more people are understanding that we can all work together. There's plenty of work, especially in your line a business.
You really
Healthcare.
have to. You really have to. And we do have, this is not just saying it and there's action behind it, but we have partnerships with other, what we consider competitors. So our competitors, and vice versa, can be sources of business. They want to, if they're having a challenge in a certain area and they can't meet that client's needs, they want to make sure to send a good referral, put them in good hands. And so we work very well with our other providers in the area.
Love that. I do love that. I remember thinking when the music industry started coming together and doing songs together, I thought, okay, now people are going to see that not only can you have your own audience, but you can also have a different audience and they can enjoy both. Like Dolly Parton and, what is his name? I can't think of his name. Anyway, she did a duet with this gentleman, and he's famous. I just can't remember his name.
Was it Kenny Rogers?
Yes, Kenny Rogers. Thank
Okay.
you so much. I'm like,
All
Kenny
right.
Rogers, yes.
That
And
came out of nowhere. I don't know where that came from.
I'm so glad you said that because it was
Okay.
going to bother me until it came
Okay.
out.
Good.
So they did a duet together, and they were two separate people that had their own audiences and their own music, and I think it stirred up some of the other people, and these younger generation started thinking, oh, wonder who I could partner up with, and so it blew up there. That's what I'm talking about, partnering with people to move both of you forward.
Right.
Yeah. So that's one of the things that I love about the Senior Estate Concierge. I get calls and emails now asking me for referrals to different things. Now, we offer two choices in each area of town, and I'm grateful that both choices can be given knowing that everyone has a background check and everybody is self-policed. That's where I'm going with this. If you do a horrible job, how long do you think it's going to be before the rest of the group knows that you're doing a horrible job and they stop referring you?
Right.
But if you're working together and you're helping each other, how long does that take to get out? It
Yeah, I
doesn't take
relied
long.
on all the members, for all, I should say specifically, I've been on phone calls with every other home care provider member that I know of that's in this group, and we can pick up the phone and call each other anytime, and we've all cross referred. So yeah,
That's wonderful. I love
yeah.
that. Well, Dawn,
That's
tell
important.
me,
It's not just taking the client, that they refer. We want to give follow up as well and go back and say, hey, just want to let you know this is where we are with client XYZ. And sometimes we've admitted and we started and we're going great. And sometimes it's, well, we went out and they said they changed their mind, whatever that is. We want to make sure that whoever sends that lead, gets to know what happened to it once they handed it over.
we talked a little bit before the show about the stress of working in a pandemic. So you said you started this and soon realized that, oops, we have a problem. Houston, we have a problem. Um, do you feel like your company has it under control? Do you feel a little more secure in the care that you're giving and the care that is available?
Yes, we've learned an incredible amount. We've had to implement technologies that we weren't talking about when this all started. Technologies such as our caregivers have to check in on their phone about their symptoms and fever free and create those attestations at the beginning of each shift. We've what's been challenging has actually not been the service delivery. We've been able to do that, and we've been able to take good care of COVID clients quickly. The challenge has just been the constant changing of update, trying to keep up with all of the rules, regulations, and guidance from CDC to OSHA to Health and Human Services. It is, you could spend your full-time job focused on keeping up with the changes and trying to implement and be knowledgeable of each of those changes, which you have to do. Keeping up with the PPE was a huge problem. We're grateful to, we have, we're in the middle of not only a pandemic, but every home health agency has to have a disaster plan. And so this is like a 2-year disaster plan that you're having to manage. It's just like nothing we've ever seen. And so, there's updates weekly, bi-weekly from the state. There's a lot to stay on top of, and we've been able to do it. It's just a huge apple to bite, and it has been a big apple.
Yeah, I see it from a different perspective than you do.
Mm-hmm.
I take care of a lady with Alzheimer's, and I had put this nice, beautiful young lady in a personal care home, and I was not allowed to go in and see her. In the very beginning, it was very stressful. It was stressful for her. It was stressful for me. It was stressful for the workers.
Mm-hmm.
It was hard to talk with this mask on, and finally, they allowed me to go in the backyard and see her through a window.
Mm-hmm.
And so I could, she had a cell phone inside, and I had my cell phone outside so we could hear each other. And it quickly disintegrated. It was so hard on her, and it was hard on me watching it. Mm-hmm. So I can't even imagine. What am I saying? I can't imagine what your caregivers were going through, and you as the business owner trying to keep everybody safe and whatnot. So I'm sure it's been rough. And we thought it would be over. Honestly, when I first heard about this, I thought, a couple of weeks, we'll be back to work. And here it is, almost 2 years later.
Right. So, and we're going to be dealing with this it's going to affect how we do business, I think, forever.
I think so too.
Maybe some good. It did drive an acceleration of some technological processes and advances that probably would have come about eventually. That's good. It's shown that we can leverage technology and still give good business service. So, for example, the emergency rule from the state, says you can do your supervisory visits virtually. So that's not only more efficient, but it is effective. And maybe we'll see things like that stay in place for the duration. You've got more and more telehealth adoption for patients to see their physicians, and they can have an effective meeting with their physician's office, and that will count towards any regulatory requirement for even a Medicare client to continue to get services and have that face-to-face. It's, a lot of our clients now are seeing their doctor over the computer. So there's things like that are probably beneficial, that may not have been able to be implemented and with the cover of regulations without the pandemic. So there's some, we'll have some gratitude for those advances that will hopefully stay with us for the long term, because whether you're private pay or whatever industry you're in, you've got to have efficiencies to deliver those services at efficient and cost-effective manner. And some of the rules are not efficient and not cost-effective, but you still have to do them. So we welcome those type of changes.
Very good. Well, Dawn, is there anything that you would like to say to our audience today that we didn't cover? I tell you, before you say it, I really appreciate you. I appreciate your experience. I appreciate your dedication and all the things that go into not only owning a business, but offering personal home care. So thank you.
Well, those are kind words. It takes a team, and we've got a great team, a dedicated team, a team that's proud of their work. So that, those are some of the recipes for success. But I guess in parting, the only other thing I would add is that November is National Home Health and Hospice Month. So we'll be celebrating that. There'll be changes to our Facebook page, our website, different testimonials, both locally and nationally. And so we are celebrating the month of November for Home Health and Hospice Week. So I appreciate the timely interview to bring attention to home health and hospice and its value to our community.
Thank you, Dawn. Well, this is Marian LaSalle and my guest, Dawn Bloomer, and we were talking about the future of senior care. So the resources and all the referrals that we're giving to families who need it it's very important. So if you have any questions, you have any thoughts, if you have anything that you need, feel free to reach out. The SeniorEstateConcierge.com is a website that will help you figure out what it is that your family needs. And as you can tell, you're going to be able to be hooked up with people like Dawn who really care about your seniors and their families.
Right.
So thank you again for joining us today.
All right. Thank you. Have a
Happy
good
Halloween.
Happy Halloween.
Bye for now.